Hi, I am Amna, optometrist from Global College of Allied Health. Today I am going to discuss about the topic of anatomy of the eyeball, part 1. The eyeball, which lies in the bony orbit, it is a shape of a four-sided pyramid. At its posterior apex, it is the optic canal which transmits the optic nerve into the brain. Superior and inferior orbital fissures allow the passage of the blood vessels and cranial nerves which supply the orbital structures. On the anterior and medial wall lies a fossa for the lacrimal sac. The lacrimal gland lies anteriorly in the supralateral part of the orbit. The orbital walls are composed of 7 bones: ethmoidal bone, frontal, lacrimal, maxilla, palatine, sphenoid, and zygomatic. The roof of the orbit is composed of a frontal bone and the lesser wing of sphenoidal bone, and the lateral wall of the orbit consists of the zygomatic bones and the greater wing of the sphenoidal bone. The medial wall of the orbit consists of the ethmoidal bones, the lacrimal bone, and the maxillary bone, and the lesser wing of the sphenoidal bone. The floor of the orbit consists of the maxillary bone, palatine bone, and zygomatic bone. The eyelid, which provides the mechanical protections to the anterior part of the globe, it secretes the oily part of the tear film, and its main function is to spread the tear film over the conjunctiva and the cornea. It helps to preventing the dryness of the eyes, and it also contains the puncta through which the tears drains into the lacrimal drainage system. The eyelid consists of a surface layer of the skin, orbicularis oculi muscles, orbital septum, a tough collagenous layer which is known as tarsal plate, the levated palpebrae superioris muscle, mullus muscle, and the conjunctiva. The eyelid skin, which is thinnest in all over the body, which consists of fine hairs, sebaceous glands, and sweat glands. Next one is orbicularis oculi muscle, which is a concentric bands of muscles. It is used for the closure of the lacrimal drainage. And the orbital septum, which is a sheet of connective tissue. Next one is levated palpebrae superioris muscle, which passes forward into the upper lid and insert into the tarsal plate, and it is innervated by the third nerve, and its main function is it helps to elevate the upper eyelid. The next one is mullus muscle. It is a flat, smooth muscle which arising from the deep surface of the levator, which insert into the tarsal plate. It is innervated by the sympathetic nervous system. The last one is conjunctiva, which is there are two types of conjunctiva: the palpebral conjunctiva and the bulbar conjunctiva. The lid skin is the thinnest, mobile with little or no subcutaneous tissues. The next one is orbicularis oculi muscle, which has two parts, orbital and palpebral parts. Their function is used to close the lids, that is blink phenomenon. It is innervated by the facial nerve. The orbital septum, which is an extension of the periosteum from the superior and inferior orbital margin, which limits the anterior or posterior extension of the blood, edema or inflammation. Levated muscle, that is LPS muscle, levated superior palpebralis muscle. It's originated from the tendon that blends with the superior rectus and superior oblique muscle. Levated aponeurosis insert into the lower two-thirds of the tarsal muscle and mullus at the upper tarsal border. The fibrous elements of the muscle which passes through the orbicularis oculi and insert subcutaneously from the superior eyelid fold or crease. The function is elevation of the upper eyelid, which is innervated by the superior divisions of the oculomotor nerve. The next one is mullus muscle, which elevates the eyelid minimally, which is innervated by the sympathetic fibers. Tarsus, which is a dense connective tissue which gives firmness and rigidity to the eyelids. Intraocular muscles, there are 4 recti muscles and 2 oblique muscles. Their origin is from the superior rectus muscle from the annulus of Sin, and the superior oblique from the trochlea, inferior oblique from the lacrimal crest. Their intersection is 5.5 to 6.5 mm. 6.9 mm, 7.7 mm from the limbus in the sclera for the medial, inferior, lateral and superior rectus respectively. The superior oblique, superior posterior and the lateral part of the sclera. The inferior oblique is from the inferiorly posterior and the lateral part of the sclera at the level of the macula. The lateral rectus muscle which is supplied by the single artery, but all the others are by the two anterior ciliary arteries. The oculomotor nerve innervates superior rectus, medius rectus, inferior rectus and inferior orbital. The trochlear nerve innervates the superior oblique and abducens nerves which innervates the lateral rectus muscle. The main function is ocular motility, that is movements of the eyes. The tear film covers the external ocular surfaces and comprised of three layers. The first one is the mucin layer, which is in contact with the ocular surfaces and produced mainly by the conjunctival globular cells. The next one is aqueous layer, which is produced by the lacrimal gland. The surface layer is the oil layer, which is produced by the tarsal meibomian glands and it is delivered to the lymph nodes. The functions of the tear film: it provides a smooth air-tear interface for the distortions-free refractions of light to the cornea. It provides the oxygen anteriorly to the avascular cornea. It removes debris and foreign particles from the ocular surface through the flow of the tears. It has an antibacterial properties through which the action of the lysosomes, lactoferrin and the immunoglobulins, particularly secretory IgA. The tears drains into the upper and the lower puncta and then into the common canaliculi. From the common canaliculi, it passes into the lacrimal sac. The nasolacrimal duct passes from the sac to the nose. The failure of the distal part of the lacrimal duct is fully to canalize at birth is usually a cause of watering and sticky eyes in the babies. Each blink of the lids helps to pump the tears throughout the eyeball. The coats of the eyeball, that is fibrous coat, vascular coat and the nervous coat, which is retina. The fibrous coat, which is the toughest outer coat, which is transparent anteriorly and the opaque posteriorly. The anterior transparent portion is known as cornea and the posterior opaque portion is called the sclera. The junctions between the corneosclera is known as limbus. The extraocular muscles attached to the sclera in these coatings. The optic nerve leaves the sclera posteriorly through the cribriform plate. The next one is episclera. It is a loose connective tissues and it is the most superficial part of the sclera which has a vascular plexus formed by the branches of the anterior ciliary arteries and its blood supply is through the sclera is a avascular structure, but anterior to the intersection of the recti muscle, anterior ciliary arteries from the episcleral plexus and the posterior sclera gets its blood supply from the long and short posterior ciliary arteries. The nerve supply is from the long and the short ciliary nerves and their main function is to the protection of the intraocular structures and gives shape to the eyeball. It provides a rigid insertion for the extraocular muscles. The first one is cornea. It forms the anterior 1/6 part of the eyeball, which is a convex and elliptical in shapes, and its dimensions are vertically 10.6 mm in diameter. Horizontally, it is 11.7 mm in diameter, and thickness at the center is 0.5 mm, and towards the periphery is 1 mm. The total dielectric power is plus 43 diopter, and it is a clear, transparent, elliptical structures vertically 9.10 mm, horizontally 10 to 11 mm, 0.5 mm thick at the center and 1 mm thickness at the periphery. The functions of the cornea is main function is to refract the light rays together into the lens and focused into the retina, and it protects the intraocular structures. There are few layers of the cornea. The first one is epithelium, an anterior squamous layer thickened peripherally at the limbus where it continues with the conjunctiva. The limbus houses its germinate or stem cells. The second one is Bowman's layer. The next layer is underlying stroma of the collagen fibrils, ground substance and fibroblast. The regular packing and the small diameter of the collagen fibrils account for the corneal transparency. Next one is desmus layer, and finally last one is endothelium, a monolayer of the non-vegetating cells which actively pumps ions and water from the stroma to control the corneal hydrations and transparency. Thank you.